Hi, nice to see you again. Today I'm going to be doing some hip and knee assessments. We're going to start with some hip flexion, so if you could please lay down on your back. Then first I'm going to locate your greater trochanter, so if you can rotate your leg in and out. About right here is where I feel it, so I'm going to put the fulcrum right there, line up the stationary arm where her pelvis, and then the moving arm with her femur. And then if you could please bring your knee all the way up to your chest as far as you can. And then she was at 10 degrees before she started, and now she is at 110, which means she has 100 degrees of range, which is below the normal, which is 140. Okay, so now we're gonna do the tibiofemoral lateral glide passive range of motion. So I'm gonna put a little bit of flexion in her leg, stabilize at her knee, and then push laterally on her tibia to see if she has any laxity on her LCL. She doesn't have any movement. Okay, now we're going to test the other side. So a little bit of flexion, stabilize her knee, and then apply pressure laterally. And she doesn't have any movement, just like her other leg. Okay, so now we're going to do the overs test, which is going to test her IT band and TFL for tightness. So I'm going to stabilize at her iliac crest, bring her leg into abduction, extension, and then abduction again. And then her leg went past the table or bed, so she is not a positive test. Now we're going to test the other side bilaterally. So stabilize at the iliac crest, bring her leg into abduction, extension, and then abduction again. And then you see her leg went down, so she doesn't have string tightness in her IT band or TFL. Okay, now we're going to do the manual muscle testing for her hip flexion. So this is a grade 4, so I'm going to resist at her leg, her knee, and then she's going to bring her knee up to the full range of motion as I resist, and then back down. And then same thing with the other leg, come up, and then come down. And when testing her hip flexors, which are her iliacus and her psoas major. And so now we're going to do the special test, resisted external derotation. So we're going to bring your leg out, hold her back here, put her into external rotation, and then I want you to push back your leg to normal position. Okay, do you have any pain with that?
No.
Now we're going to do the other leg. Come on. Put it into external rotation, then I want you to push back to normal. You have any pain with that?
No.
Okay. So we were testing for gluteal tendinopathy. This test has a high specificity, which means it's good for ruling in conditions. Alright, now we're going to do the special test, Lachman's knee test for your ACL. So I'm going to grab her leg right here and stabilize, and then push anteriorly to test for laxity on her ACL. She has a normal in range. And then we're going to test the other side. And then pull anteriorly. And it feels the same as the other leg. And this test has a high specificity test, which means it's good for ruling in conditions. Okay, now we're going to do the palpation of the semitendinosus hamstring muscle. So she's going to bring her leg into flexion. And then I'm going to find her ischial tuberosity, which is right here. Then I'm going to follow medially, and I'm going to feel the belly on the medial side of her leg. And then her tendon is going to come all the way down to her, past her knee and attach to the pes anserina. Okay, and then now the other side, flex up. Same thing, ischial tuberosity, and then follow medially, feel the belly, and then her tendon.